next section of the manual. Typically, as always, I have to scroll through because for some reason I haven't quite worked out how. I just skip straight to a certain page. However, we are looking for our skin analysis. Here we go. Skin conditions. Skin types and analysis. So skin types. There are obviously various different skin types, and what we're going to go over within this section is how to identify client skin type and how to treat different skin types. So the four most prevalent types of healthy skin: normal, dry, oily, and combination. And it's worth just having a rough idea of what these skin types look like, what they feel like. I mean, for me personally, I tend to have kind of combination. I tend to kind of get a dry T-zone area. I can get dry around my brows, but I also have very oily skin, which sometimes can be frustrating, but it is very good for fine lines and wrinkles. I mean, my mum has the same skin type and she does not have a line on her face. So just to go over some of the skin types. So we've got normal skin. So what is normal skin? It's common to refer to balanced skin as normal. Healthy skin is referred to as ergomatic in medicine. T-zone, forehead, chin and nose may be slightly oily, but overall sebum and moisture levels balanced, preventing either excessive oiliness or dehydration. So, like I say, I do have excess oil. I don't really have too many areas of dehydration. How do we identify skin types? So how to identify normal skin. So a normal skin type, for example, would have fine pores, so tiny little pores, good blood circulation, so good colouring to the skin, a velvety, soft and smooth texture, fresh rosy colour, and is not prone to sensitivity. You can kind of feel when you're doing a facial and you do your skin analysis, you can feel your client's skin, you can feel and you can see that hydration. Dry skin, I mean, it's fairly obvious. If a client has dry skin, they're going to have flaky skin, it's going to be dehydrated, they tend not to moisturize, not to drink too much water. So dry skin refers to a skin type that produces less sebum than regular skin, so less oils. Due to insufficient sebum production, dry skin lacks the lipids needed to retain moisture and act as a barrier against the elements. As a result, the barrier function is compromised. Women are substantially more likely than men to experience dry skin. All skin types become drier as people age. So what are some of the reasons we would have dry skin? So skin moisture depends on the supply of water in the deeper skin layers. Skin is constantly losing water via perspiration, active water loss from the glands caused by heat stress activity, transepidermal water loss, lack of urea, amino acids, and lactic acid are examples of natural moisturizing factors. So, how to identify dry skin? Moderately dry skin might look drab, feel tight, fragile, and scratchy, and will also lack in skin subtleness again, so you can kind of feel that. There may be signs of flaking, especially around the corners of the nose. So for me, if I do ever get any dry skin, I tend to kind of get it around here and around here. Generally, clients are going to have dry skin if they're not hydrated enough and they're not using products on their skin at all. Oily skin types. Oily skin is caused by over-secretion of sebum. An oily substance our skin needs in order to function properly. Too much of the sebum can cause acne, and too little can cause dry, cracked skin. I mean, I'm really lucky. I don't tend to get acne now, but when I was younger, I definitely used to suffer, and that is a result of the oily skin. Now I kind of just get, I guess, almost like a bit of a shine where I do produce too much oil. Those with oily skin are more likely to experience comedones, blackheads and whiteheads. I definitely do experience those. And the various forms of acne. When acne is mild, there are numerous comedones on the face, as well as frequently on the neck, shoulders and chest. So what causes oily skin? Genetics, hormonal changes and imbalances, medication, stress. How do we identify oily skin? I mean, it's fairly obvious, but obvious to me maybe because I've got oily skin. Enlarged, clearly visible pores, a glossy shine, thicker pale skin, blood vessels may not be as visible. Makeup potentially slide off the face. The client may need to dab off excess oil regularly. I mean, when I was younger, I don't know if any of you remember, I used to have those pads. I don't know if any of you remember that. I used to have them, but if any of you remember them, they were from the Body Shop, and they were like little dotting pads, and you just used to dot them on your skin. I know my sister Candy, she has super oily skin, and sometimes she uses those. And then we have combination skin. So combination skin, as the name suggests, is skin that consists of a mix of skin types. So it can be dry and oily. So like I mentioned earlier, I tend to have combination. Generally, I am oily, but on the odd occasion, I will get a dry T-zone, especially if I'm not sticking to my skincare routine. How to identify different types of oily skin, and then how to identify different types of combination skin. So the causes of combination skin, the oily areas of combination skin are caused by overproduction of sebum, and then the dry patches on combination skin are caused by lack of sebum, which makes total sense. Skin evaluation. So when you are doing your facial, it's really important to do a skin analysis, skin evaluation. Not only does this help you choose the right products and the right treatments and the right facials for your clients, but it's really good for the consultation, for informed consent, and for giving your client the information that they need. When you do the skin analysis, you don't necessarily need to use a magnifying lamp. I mean, we do have one in the salon, but it does help you see all those small, tiny lumps and bumps. And a little tip, always just feel around the skin as well as visually noting what you can see within that skin diagnosis, skin analysis. Generally, you are going to see comedones. Some clients have milia. Within the Ultimate Facial course, we do teach you extraction, so milia removal. Pore size, have they got wrinkles and fine lines, broken capillaries, crepey skin, shiny oily patches, dry flaky patches? Skin colour, is the skin young or mature? What's the texture feel like? What is the colour like? All of this you will be noting down on your consultation form. Skin evaluation, so pH balance. Are you aware what pH balance is? So pH refers to the balance of acid and alkali in your skin. So that's how acidic the skin is. So naturally the skin is slightly acidic and it has a pH balance of around 5.5. Many foods and skin treatments have the effect of changing our pH slightly and putting it out of balance. Soaps in particular are alkaline, and therefore this can increase skin pH above its natural levels. Fitzpatrick phototype. So there are a couple of kind of scales where we can analyse skin. So Fitzpatrick is a test that gives us an idea how our skin reacts to the sun. Do we have an example here? Yes. So you would get your client just to go through these questions. And I mean, the Fitzpatrick scale is really important when you are doing, for an example, a chemical peel, because we want to see how client's skin reacts to the sun, or laser hair removal, IPL, for example. And it will include questions like, what's your eye colour? What's your natural colour of your hair? How does your skin react in the sun? How do you burn? And you answer 1 to 4, you work out the total score at the end, and it will give you your average skin type. And then we've got the Glogau skin classification. So this is a wrinkle scale that measures the severity of wrinkles and photoaging. Photoaging is the premature aging of the skin, which is usually caused by too much exposure to ultraviolet rays. So this classification system helps practitioners pick the most appropriate procedures for the treatment. So I'm just going to finish this recording, and next we'll move on to the exciting stuff, so the facial process itself.